Another one bites the dust. Another one bites the dust. And another one gone, and another one gone. Another one bites the dust. Hey, hey, gonna get you too. Another one bites the dust.
Yeah, another one bites the dust. Some people just can't bite anything. But they go and see Dr. Bobby Birdie and Dr. Ron Zokol and at BC Perio Dental Health and Implant Center. And after that, they come and just bite anything, right?
That's right.
Yeah. Now, before the break, or during the break, actually, you were telling me that you folks deal with PRF and PRP. What is that?
Okay.
Okay.
These are called biologics in our world, and not very many dentists are familiar with it. But what they stand for is platelet-rich plasma and platelet-rich fibrin. And these materials are harvested from your blood. So what we do is we draw blood from our patients, and we use their own platelets. Now, what's interesting about platelets is that they're part of the healing structure of the blood system, if you will. So they have these growth factors that are very, very useful to increase the rate of healing of soft tissue, bone structure, and such. And when we use them in our surgical procedures, we actually get significant reduction in complications of all the surgeries we do. The healing process is faster. There is so much, and it's your own material. You're not sticking somebody else's or cow material in somebody at that point, but we're using their own body tissues and their own basic healing structures to do this, and that makes a significant difference in the quality of the outcome and the rate of healing.
That's very interesting. So, heal thyself.
Yeah, absolutely. It's pretty amazing stuff. If you just think about it, to be able to use your own, stuff from your blood to whip it down and actually use it in your own body in another part to help restructure or regrow things. It's pretty amazing. It's amazing that your body has the ability to do that for you as long as we use it in the right way, and we do it for almost every surgery we can. And it just adds that much of an oomph or that extra bit of plus that we're able to get a good result. Maybe the result that would have been may not have been able to grow as much or do as much. It takes it over that edge, and that's pretty amazing.
Yeah. As a matter of fact, 2 weeks ago, Tom, we had a group of people from all over North America, all over the U.S. that came into Vancouver at our facility, and we were training them how to do this and how to use it.
That's interesting. I was going to ask you about that because I know there are some hospitals in the area that are known as training hospitals. But at BC Perio Dental Health and Implant Center, you folks also do some training.
Well, we have the Pacific Implant Institute. Bobby and I run the Pacific Implant Institute, and we teach dentists how to do what we do. We build their skills so they can go back to their office and competently do the procedures that we train them for.
How long does it take the average dentist to learn these skills?
Okay. Well, our program takes almost a year long.
Okay.
And on about 12 sessions we train them. But it takes their growth in their surgical skills and prosthetic skills they learn as they go. So it's a progressive thing. Sure. What we do is increase their rate of learning. We give them a foundation where their growth will accelerate from where we leave them. But just like dentistry as a whole, your training plus your experience yield what you can do in this field and to what degree you're capable of achieving very, very highest results. And so what we do is we step that up so their learning curve is faster.
So when these dentists finish their training sessions with you guys, they know their stuff.
Absolutely. I think what we've done this year is try to adopt things where if you don't want to do the whole year, we've got a couple 5-month mini-residency programs which aren't as advanced but allow you to get some of the skills, and then it's stepping stones till you kind of keep going. And eventually, even after the 1-year program, we provide you with all the information and all the skills and the experience to do what you'd like to do. But then it's up to you. You've got to go and spend the time and work hard about it. And it takes time. Like Ron's been doing this for decades. He's been doing this for a long time and doing really well. And the amount of skill and experience, you can't just get that out of a 1-year course. Let's put it that way. It takes a lot of time.
No kidding. Now, if you find this very interesting and you'd like to get some more information, actually give the good doctors a telephone call. In Vancouver, the telephone number to the office is 604-872-0222. That's 604-872-0222. Or if you're in the Coquitlam area, the number to your clinic in Coquitlam is 604-936-8244, right? Or go to the website, bcperio, Perio.ca. BoomerLife.ca.
That's right.
Yeah. So how old do you have to be to get implants?
I would say that you got to be finished growing. So your facial growth has to be done. So for most people, that would be after the age of 20, most times. But I will tell you that if someone comes in and they're 20, I do a lot of discussion about how much have you grown, how much have you done, this and that, and then we look at getting special X-rays to make sure they're done growing. Because what we don't want to put an implant into someone that's still growing, because the implant's not going to move. So it's not going to grow. That area will not grow with the rest of the face, so it can be a really bad situation.
So what we're talking about here, we're talking about people with specific needs. We're not talking about cosmetic dentistry.
Oh, we do a lot of cosmetic dentistry as well. Absolutely. We place implants. We do a lot of things, but I'll tell you a lot of what I'm doing, and I know Ron's doing, is a lot of anterior or front teeth, and that's very cosmetic, whether it be doing a smile design or smile makeover, but it involves implants a lot of times.
And the reality is, it's just about everything we do has a cosmetic factor, and the closer it is to the front of the mouth, the more significant it is.
Yeah.
Okay, we'll just added this part out here.
There's some dead air.
Okay. No, it's just that I get to do it.
Yeah, I was gargling there.
Okay. So let's just pick it up. Okay. Help me here. Yeah. What are you able to roll it back? No, or is... No, just so we can hear what Ron said. Can you do that, or is that not possible?
It's about cosmetic dentistry, right? So
okay. Because maybe what we should do is get you to give your answer again, and then we can just pick it up from there.
Yeah.
Okay.
So it can be a really bad situation.
So what we're talking about here, we're talking about people with specific needs. We're not talking about cosmetic dentistry.
Oh, we do a lot of cosmetic dentistry as well. Absolutely. We place implants. We do
out here.
Smile design or smile makeover, but it involves implants a lot of times.
And the reality is, it's just about everything we do has a cosmetic factor, and the closer it is to the front of the mouth, the more significant.
Okay, so Ron will pick it up from there. So wait till he's going. Oh, great! Now somebody's breaking in. We want to break out. Somebody's breaking in. So when he starts the tape up again, we'll just get you to pick it up.
I can pick it up.
Okay.
Oh, fast.
That happened at 4 o'clock one morning, and I don't have the code.
Oh, shoot.
Next thing, the cops are here. I'm allowed to be here. Okay. Holy crapola, huh? Yeah, well, give people the code. That's what they got to have, is the damn code. All right, so Dr. Ron's going to pick it up. So he's going to just pick it up with what he was saying. So, okay.
And the reality is that almost everything we do has a cosmetic factor to it. The closer the work we do that is to the front of the mouth, the more important the cosmetic factor becomes.
You ever have people that come in that actually have no front teeth at all?
Oh yeah, I actually dealing with a patient this week with that who came in and she used to be a police officer, and she said I lost my front teeth and I don't like wearing this little partial denture, or she calls it a flipper, and she comes in and she's like, I want front teeth, and all of her front teeth are missing. So yeah, it's very common for us.
What about people that suffer sports injuries? Do you see many of those?
Yeah, absolutely. I think we see, and Ron will attest to this too. We see people, a lot of hockey players that a lot of hockey players, especially if you're playing in the WHL or playing in somewhere, a lot of times we'll say, well, wait till you're done before you get your teeth fixed and all that. So we see a lot of players like that. Absolutely.
Or better yet, don't stop the puck with your teeth.
Absolutely.
Defensemen have a terrible habit of doing things like that.
So people come to see you for a lot of different reasons: sports injuries, car accidents, what have you, mishaps at the home. So there's just an abundant group of different reasons to come and see you folks.
Yeah.
Yeah.
Plus, a lot of coffee.
Yeah.
Plus your coffee's pretty good too, and you're easy to find. You've got the brand new office.
That's right.
Wow, down on Broadway.
That's right.
Broadway and Willow.
Yep, Broadway and Willow, 777 West Broadway.
All right. Shall I test you with the phone number?
Sure.
Okay.
It's 604-872-0222.
You get a name for that. That's very good.
Yay.
604-872-0222. That's the Broadway office.
Yep, and then the Coquitlam office is 604-936-8244.
Okay, so if somebody wants to make an appointment, just give your receptionist a call, and he or she, because you do. What's the guy's name? Jim.
James? Jim. Yep. Jim Turner's one of our receptionists. Yeah.
So they'll fix it up and pave the way for them.
Absolutely.
Yeah. and you go back and forth between the two offices.
We do. We have Ron does as well. We have another doctor as well that we work both offices. So it's great because the Tri-Cities area, it's nice to have a presence there, and there isn't a lot of prosthodontics or periodontics or this kind of stuff being done in the area. So it's nice to be there and be able to help out the public and also our colleagues for sure. And then, of course, Vancouver's fun. There's a lot of stuff going on there, and there's a big office, so it's a lot of fun to be there.
It's a great office.
It is.
Yes. You mentioned prosthodontics and
periodontics.
What's the difference?
Well, a periodontist is someone that works on gum tissue, does implant surgery, works on periodontal disease, gum disease, does tissue grafts, that kind of stuff. Whereas a prosthodontist is a specialist in crown and bridge work, implant restorations, implant dentures, teeth in one day, that kind of stuff. And those are the two specialties that I have.
It seems kind of complicated to me, being just your average radio announcer. But Ron, I know that your dad was a dentist, right?
Yes.
So you probably had the bug at an early age.
Yes.
Now, Bobby, what about you?
I'm no one in the family's a dentist except for me.
Really?
I got a lot of my dad. My dad was worked at a steel factory for years, and my mom worked at the bank. So I didn't have dental parents by any means. But I just liked it because I could work with my hands, and it was a lot of fun. I enjoyed it. I thought I'd go into medical school. I just realized I don't like hospitals.
You try woodworking?
Woodworking's fun too.
Your brother's a doctor, isn't he?
Yeah, he's a medical doctor. Yeah.
Wow, this is exciting. So Ron, you watched your dad and you thought, this is kind of neat work.
Well, actually, it worked out a little differently than that. And my father tried to talk me out of it.
Really?
Yeah, he did. And it's probably for a different reason than you might expect. But he didn't want me to go into dentistry for the wrong reason. And he didn't have a lot of choice, and I was going. And so but when I graduated, I don't think there's anybody more proud than my father. And then we spent 20 years in practice together. That was really wonderful.
That must have been fun.
It was great. And he was a prosthodontist.
Really?
Yeah.
So you learned a few things from Dad?
Learned a lot of things from him.
And Dad learned a few things about you? Oh, my God. Let's, in case somebody's just tuning in, let's talk about the benefits now of dental implants.
Well, dental implants have completely revolutionized and changed dentistry altogether. The reason being is because there's not a better way that we have anywhere in the world to replace a tooth. It comes in, and a dental implant is something that we put into the jawbone that replaces the root of your tooth.
Mm-hmm.
The best benefit of an implant is that it stimulates your own bone to stick around just like a tooth would. It provides the biting forces and the chewing forces up to almost 95 to 98% of what a tooth would. And when we finish everything, really, when it comes to doing crowns and implants, which is one of the many things that we can do with implants, is that when it's done, it's going to feel and look like a real tooth would.
So if somebody came in and they had just some minor problems and needed maybe one implant, could you do that in one day?
Absolutely. A lot of times you can do that one day, and the best thing about an implant is you never can get a cavity on an implant, never need a root canal on an implant, and they last a long time.
A long time.
A long time.
Would you say a lifetime?
I would say, I say that to my patients a lot, to be honest with you. I tell them that if you're healthy, the implant goes in stable and has a lot of bone around it. It's restored well, as long as you continue on with your maintenance throughout your life. Aside from a few prosthetic complications that can arise once in a while, will include with anything, they'll outlast you.
Yeah, it really is one of the few procedures in dentistry that has the potential to last you the rest of your life, and all you have to do is a few very basic things on a routine basis to make sure that it does.
Let me ask you, a couple of dentists here, maybe you could pass along a couple of tips to the people that are listening today. First of all, you and I talked about this. Do you brush first or floss first?
It depends how dirty your teeth are, actually.
Okay.
But I like to brush first, then floss, then brush again.
Okay, and the reason for that?
Well, in the flossing, I don't want to push debris down into the gums when I'm flossing. So if I can get rid of the gross debris out there, then I go clean the side of the tooth. And if I'm really diligent, if there's any debris left over, I'll swish it out and brush slightly over top of that.
All right,
to be most effective.
Here's another question for you. Why did the Buddhist refuse the Novocaine injection?
You talked to Tom.
Because he wanted to transcend dental medication.
Oh, God.
Our producer liked it. Oh, geez. You guys, you take care of people's lives. You take care of people's health. You do everything down there.
We try our best to do what we can.
You just do a fine thing.
We're trying.
Yeah. So, again, people want to come and visit you on Broadway. It's a fairly brand new office.
Yep, absolutely. It's a brand new office, which has been open for... We used to have... It was 3 offices that were separate before, that we've combined into one center. Those 3 offices were open for 10 to 30 years. And then the new office has now been open for about a full 6 months, and it's been great. It's fun to work together. It's fun for everyone to be together, and it's nice to have everything under one roof. We can do so much. It's great.
We always talk to our two doctor friends here, Dr. Ron Zokol, Dr. Bobby Birdie. Who are the other gentlemen that work with you?
We have 3 other specialists in the office. We have Dr. Josh Kleiman, who's a periodontist in the office, Dr. Peter Munns, who's also a periodontist in the office, and then Dr. Tim Gould, as well as a periodontist in the office.
And are they as gentle as you guys are?
Oh, yeah.
Really?
They're great guys,
They're
absolutely.
Do you think they like my jokes, too?
They probably got some of their own, too.
Well, maybe. Maybe I should give them a call. I'll get them on the show next time, too.
Yeah, sure.
Oh, you have all 4 or 5 dentists down here. It'd be a lot of fun. It's Boomer Life on Soft and Easy and Smooth and Easy, CL650, and we're back with more in just a moment.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CL650.